A care manager plays a vital role in the healthcare industry, ensuring that patients or clients receive the necessary care and services tailored to their individual needs. Whether working in a hospital, nursing home healthcare setting, or a community health program, care managers are integral in promoting the well-being and quality of life for individuals in their care. They coordinate, oversee, and advocate for comprehensive care, ensuring that services are efficient, effective, and accessible. The job description of a care manager can vary across healthcare settings, but their core mission remains the same: to ensure patients receive the appropriate care and support in a compassionate, timely, and cost-effective manner. Care managers serve as a bridge between healthcare providers, patients, and their families, facilitating communication, managing resources, and addressing concerns as they arise. In this video, we will explore the roles and responsibilities of a care manager, the skills required for success in this role, and why care managers are essential to ensuring optimal health outcomes for patients. Whether in a hospital setting, home care environment, or long-term care facility, the contributions of a care manager are fundamental to the healthcare process. Overview of the role. A care manager is a healthcare professional responsible for coordinating and overseeing the delivery of care to patients or clients. Their role is often centered around assessing the needs of individuals, creating personalized care plans, and working closely with a team of medical professionals to implement those plans. Care managers are often tasked with monitoring patient progress, advocating for necessary services, and ensuring that healthcare plans are delivered in a timely, efficient, and cost-effective manner. Care managers work in a variety of settings, including hospitals, home health agencies, nursing homes, and community health organizations. In each of these environments, their goal remains the same: to improve patient outcomes by ensuring that patients receive the highest quality of care tailored to their specific needs. In addition to their clinical expertise, care managers must possess strong communication, organizational, and interpersonal skills, as they frequently serve as the primary point of contact for patients, families, and healthcare providers. Roles and responsibilities of a care manager. The job description of a care manager encompasses a wide range of responsibilities, from patient assessment and care plan development to coordination with healthcare teams and monitoring patient progress. Below are the primary roles and responsibilities that care managers typically undertake in their position. Assessment and evaluation of patient needs. One of the first tasks of a care manager is to assess the physical, emotional, and social needs of the patient. This involves conducting interviews with patients, their families, and other healthcare providers to gather relevant information about the patient's medical history, current health conditions, and personal circumstances. Care managers use this information to develop a comprehensive understanding of the patient's needs. This assessment may involve reviewing medical records, conducting interviews, and possibly administering diagnostic tools or questionnaires to evaluate the patient's functional abilities. By identifying any gaps in care or unmet needs, care managers ensure that patients receive the appropriate services and support. Development of care plans. Based on the assessment, care managers work closely with patients, families, and healthcare teams to develop a personalized care plan. This plan outlines the specific medical treatments, therapies, and services that the patient will receive, taking into account their individual needs and preferences. A well-developed care plan may include details such as medication schedules, rehabilitation therapies, nutritional needs, and psychological support. It also specifies the roles and responsibilities of the healthcare team, outlining how different professionals will work together to provide comprehensive care. Care managers ensure that the care plan is aligned with both the patient's goals and medical needs, optimizing outcomes and improving the quality of life for the patient. Coordination of services and resources. Care managers act as liaisons between patients, families, healthcare providers, and other service providers. They coordinate the delivery of healthcare services by scheduling appointments, arranging referrals to specialists, and ensuring that all necessary services are provided. For instance, if a patient requires physical therapy, the care manager will coordinate with therapists to arrange sessions and ensure the patient receives the care they need. In addition, care managers help patients navigate complex healthcare systems, assisting them in understanding their insurance benefits, coordinating transportation, and ensuring that they have access to necessary medical equipment. This resource coordination is particularly important for individuals with chronic conditions, disabilities, or those requiring long-term care. Monitoring and follow-up. Care managers continuously monitor the progress of patients and ensure that the care plan is being followed effectively. This may involve regular check-ins with the patient, family members, and healthcare providers to track the patient's condition and any changes in their needs. Monitoring also involves evaluating the effectiveness of treatments and interventions to determine whether adjustments to the care plan are necessary. If issues arise during the course of treatment, the care manager steps in to address these concerns, such as coordinating additional care or adjusting the care plan as needed. Regular follow-ups are essential for ensuring that the patient's health is improving, that there are no gaps in care, and that any emerging issues are addressed promptly. Patient and family advocacy. Care. Managers are patient advocates, ensuring that the patient's rights and preferences are respected throughout their care journey. They work to ensure that patients receive timely and appropriate care, and they advocate for the patient's needs within the healthcare system. In addition to advocating for the patient's medical needs, care managers also act as liaisons between the healthcare team and the patient's family. They provide updates on the patient's condition, explain medical procedures or diagnoses, and help family members understand their roles in supporting the patient's care. They also address any concerns or questions that patients or their families may have, fostering an open line of communication. Education and empowerment. Care managers educate patients and their families about the patient's condition, treatment options, and care requirements. They provide valuable information on how to manage specific health conditions, medication management, dietary needs, and other aspects of health and wellness. Empowering patients with knowledge about their health helps them take a more active role in their care, leading to better health outcomes. For example, a care manager may educate a diabetic patient on how to monitor blood sugar levels or advise a family caregiver on how to assist with mobility exercises. Discharge planning. When patients are ready to leave a hospital or other healthcare facility, care managers are often responsible for planning their discharge and ensuring that they have the necessary resources in place to transition to home care or a different level of care. This involves providing instructions on post-discharge care, arranging follow-up appointments, and coordinating with home health aides or other services if necessary. Discharge planning is particularly important for patients with complex medical needs or those who require ongoing care after leaving the facility. The care manager ensures that patients do not face interruptions in their care and have access to the resources and support they need for a successful recovery. Managing transitions of care. A critical role of the care manager is to oversee transitions of care, ensuring that patients who move from one setting to another, such as from a hospital to a nursing home or from a rehabilitation center to home care, do so smoothly and without disruption to their care. Care managers help patients navigate the complexities of transitioning between healthcare providers and settings. They ensure that medical records are transferred, care plans are updated, and the new healthcare team is fully informed of the patient's needs and preferences. Evaluation and quality improvement. Care managers assess the effectiveness of care delivery by evaluating patient outcomes, patient satisfaction, and overall quality of care. They may collect data on patient progress, monitor key performance indicators, and provide feedback to healthcare providers and administrators to improve care processes. By identifying areas where care delivery can be improved, care managers contribute to the ongoing enhancement of healthcare services. This commitment to quality improvement helps ensure that patients continue to receive high-quality, personalized care. Skills required for a care manager. The job description of a care manager requires a combination of clinical, organizational, and interpersonal skills. These skills enable care managers to provide effective care coordination, build strong relationships with patients and their families, and navigate the complexities of the healthcare system. Below are the key skills that are crucial for success in this role. Clinical knowledge and expertise. Care managers must have a solid understanding of medical conditions, treatments, and healthcare practices. A background in nursing, social work, or a related healthcare field is often required. Their clinical expertise enables them to assess patient needs accurately, develop appropriate care plans, and identify potential issues early on. Communication skills. Effective communication is essential for a care manager, as they must interact with patients, families, healthcare providers, and service organizations. The ability to convey complex medical information in a clear and empathetic manner is critical. Care managers must also be skilled at listening, understanding patient and family concerns, and fostering open communication channels. Organizational and time management skills. Care managers often juggle multiple cases and responsibilities simultaneously, so strong organizational and time management skills are essential. They must prioritize tasks, manage schedules, and ensure that all aspects of a patient's care are coordinated efficiently. Problem-solving and critical thinking. Care managers need to be able to think critically and solve problems quickly. Whether addressing changes in a patient's condition, navigating insurance issues, or coordinating complex care plans, the ability to make informed decisions is vital. Critical thinking helps care managers to anticipate potential challenges and find practical solutions. Empathy and compassion. Empathy and compassion are essential qualities for care managers as they work closely with individuals who may be facing significant health challenges. Understanding the emotional and psychological aspects of patient care helps care managers provide support and guidance in a way that fosters trust and comfort. Leadership and advocacy. Care managers often lead interdisciplinary teams and advocate for their patients. They must be able to guide and motivate team members, ensure collaboration, and serve as a voice for the patient within the healthcare system. Attention to detail. Attention to detail is essential for ensuring that all aspects of a patient's care are properly coordinated. Whether reviewing medical records, monitoring patient progress, or tracking medication schedules, care managers must be meticulous in their work to prevent errors and ensure quality care. Cultural competence. Care managers work with patients from diverse backgrounds, so cultural competence is crucial. Understanding and respecting cultural differences ensures that care is provided in a way that aligns with the patient's values and preferences. Education and experience. Care managers typically hold a degree in nursing, social work, healthcare administration, or a related field. A registered nurse, RN, or licensed social worker, LSW designation is often required, and additional certifications in case management or care coordination are highly beneficial. Experience in healthcare settings is essential, as care managers must be familiar with clinical practices, medical terminology, and patient care processes. Experience in direct patient care or as a case manager helps individuals understand the challenges and complexities of coordinating care. Conclusion. The job description of a care manager is multifaceted, requiring a combination of clinical knowledge, organizational skills, and compassion. Care managers are at the heart of healthcare delivery, ensuring that patients receive the right care at the right time. They act as advocates, coordinators, and educators, ensuring that patients and their families receive the support they need to navigate the often complex healthcare system. Whether working in hospitals, home healthcare settings, nursing homes, or community health organizations, care managers make a significant impact on patient outcomes and the overall quality of care. Their contributions help ensure that patients receive personalized, effective care that aligns with their individual needs and goals.